this is what you're going to be doing for the rest of your life. Give it your 100%. This is residency. You're a resident because you live at that school.
Hello, everyone. Welcome back to Through the Wire podcast. This is season 2, episode 4. My guest today is Dr. Deena Fatehi. I'm so excited to have her because we went to USC together and she's currently doing her orthodontics residency and she'll be graduating in just a year. So congrats to you, Deena. She'll be telling us about her journey throughout dental school and orthodontics residency. So if you are interested in orthodontics, this video is for you. Thank you so much, Deena, for coming on today. All right, enjoy. Dr. Deena Fatehi, please introduce yourself. Tell us a little bit about your dental journey, where you are now in the process, and anything that you'd like to share.
Perfect. Well, thank you so much for having me. I'm so excited to be here. So, I went to USC for undergrad and knew I wanted to do dentistry just because practically everyone in my family are dentists. So, there wasn't much of an option. So, I had a lot of exposure as a kid to the career, to just dentistry in general. And so, I ended up, shadowing in undergrad and joining pre-dental clubs that we had on campus and realized that dentistry was what I wanted to pursue. I applied to the California schools because I knew I wanted to stay in California and ended up getting into both Loma Linda and USC. I decided to stay at USC and was there for 4 years for dental school. From there, my second year had some doubts on whether or not I wanted to continue on with dentistry. So I was very close to actually dropping out, applying to medical school until I decided to explore the specialties in dentistry. And so from there, I looked at oral surgery, pediatrics, and orthodontics, shadowed all of those specialties, and found my passion in orthodontics. Had my first baby in dental school, and then got into a program, an orthodontic program, and then had my second baby, my first year of ortho residency.
Oh my goodness, you've done it all. You've gone through it all. So let's talk a little bit about first dental school. Actually, I don't know if you know this, but I remember when I was in dental school, I was shadowing with a UTA, or I was volunteering with the UTA, and I remember you were a pre-dental student there. So you were involved really early on. And then through dental school, you were class president, you were very involved. And I feel like a lot of those extracurricular activities probably helped you get into ortho. I don't know if they did, but could you speak a little bit about your extracurriculars and which ones were your favorite and which ones you think really made you stand out?
Yeah, so I credit where I am today on two things that my dad and mostly my dad had always told me. And those two things were always look ahead, be 10 steps ahead, just do what you love to do. And so really that's what I did. As a pre-dent, I look 10 steps ahead. I know the end goal is dental school. So what do I do now to get there? That was the same in dental school to keep my doors open. So my first year of dental school, I'm a people person. I love being involved. So following my dad's guidance on do what you love to do, and that was being involved. And so luckily, kind of being involved kept some doors open for me in case I did want to specialize because
Hmm.
it gave me experiences that number one, helped me grow as a person to be able to handle the challenges of residency, in my opinion, but also it just opened doors in the sense that residencies, I think, really liked seeing what I had on my application. I do feel like everything that I did extracurricular, no matter what it was, every single thing I had on that application was really geared towards applying for ortho.
Yeah, that's
Because I was
definitely a
looking at
great
10 steps.
mindset to have. And I'm sure it definitely really helped you achieve your goal of becoming an ortho resident and a soon-to-be orthodontist. So you mentioned during your second year, you were debating on leaving dental school or maybe you were considering medicine. What drew you to orthodontics and like what made you decide you wanted to apply to ortho residency and this is what you wanted to do as your career?
Yeah, so I think after the end of my first year, I was in this space of I don't like practicing crown preps in the sim lab, and I just didn't really enjoy the filling and the drilling. And I have so much respect for all of my friends who are in general dentistry. I think it's an amazing profession. It just wasn't for me. So I think what I was really looking for was the treatment planning aspect and using my brain to solve a puzzle. And that's what kind of at that point drew me to medicine because I, knew in my mind and in my heart that I need to go to work and use my brain and solve something because that's what I've done as a kid. Like
Mm-hmm.
that's what my passion is. And so, I someone told me, I forgot who it was, someone was like, "Oh, you should check out orthodontics." And I'm like, "Okay." And so it was very similar to medicine in that sense, that it wasn't so much the hand skills, but a lot of the career was using your brain and solving a puzzle. And so I think that's what really drew me to ortho.
Yes, I agree. And I'm so happy that you're finally in ortho residency because a lot of what you do in ortho does involve using brain power versus using hand skills. So I think it's a great profession, and I'm so happy that we're both going into it.
Heck yeah.
So now that you're in residency and you went through dental school, your second year in residency, how is it compared to dental school? Like, how would you compare your classes, the lectures, the clinic, the presentations, things like that? And it was it what you expected it to be?
It was not what I expected it to be, that's for sure. Um, so I was just telling my husband the other day and my family that residency is the most challenging time in my life compared to any schooling I've ever done. And
Mm-hmm.
that's saying a lot because USC undergrad was a very difficult program. USC Dental School, was difficult. And this just beats it by miles. And there's a few different, aspects. There's a few aspects as to how, ortho is different from dental school. So I'll kind of get into each one. Class size, right? So dental school, our class, including international students, was like 200 people. Four classes, you have about 800 dental students, right? I mean, it was a very big
Mm-hmm.
class. You know that you were there with me. Here in residency, it's six people, including me, right? So five other residents. And I think that's a bit difficult. I think the dynamic of having a smaller class, even if you have or six of the best people in the world, it's tough. Like it's six people, you're with these six people all day, every day. It's different than being with 200 times for 800 people, in a building.
Mm-hmm.
So that aspect I think is challenging. It's like microscope is on you, microscope is on your co-residents. Like it's a very small class. That I don't like as much compared to being in a bigger school. As far as classes, it's very individualized compared to dental school. So dental school, I felt like I was just one of many, and that faculty just didn't have the time to give me one-on-one time just because there were so many people. So what's nice about being one of six is that you get more time to really delve into and ask questions about what it is you're going to do for the rest of your life. So that part of it's, I think, better than, dental school. Workload, every program's different, but I assume they're all pretty similar. I mean, the workload is just out of this world.
Mm-hmm.
So as far as work, there's just nights where I'm like, how do I even get stuff done? I mean, it's just so much. I'm up super early. I finish late and workload compared to dental school, compared to undergrad, it's just mountains of work that it's a lot more difficult. So but it's great. And the best part of it at this point is doing something I love. And that's why I don't complain about it because I actually like what I'm doing. So
Mm-hmm.
that's like the best part about it all.
Yes. Well, congrats to you. You're making it look easy, even though we know it's not easy. And another thing that you're doing is your mom, not only of one, but of two. So if you're comfortable sharing, I know you've shared a little bit about your first baby from dental school because I heard about you on other podcasts, like on Dental Download podcast. But I would like you to share like a little bit about your second pregnancy because that was during residency.
Yeah, so first pregnancy, Easy, super easy. I was at school up until the day I delivered. I delivered my baby and I was back 9 days later. I was like, perfect. Let's just do it again. Have them close in age. Awesome. So I found out I was pregnant February before I started my program in June. And I remember telling my parents and my dad just saying, oh no, oh no. I'm like, why are you saying, oh no? This is going to be great. It's going to be fine. It's going to be like the first pregnancy. And my dad just shook his head. I'm like, "Guys," he knew, like, he knew that this was going to be the most treacherous pregnancy that I ever thought I'd have. So everything honestly was great up until the weekend before I started my program. So I'm like getting ready for orientation, super excited. And the Friday before I started, that Monday, so 3 days before I started, I had bleeding and drove to the hospital, thought I had a miscarriage. They initially couldn't find the heartbeat, and, they ended up finding it. They almost delivered me at 24 weeks. So I was 24 and a half weeks, and they gave me all the shots. They were like, you might have this baby now. I'm like, what do you mean now? Like, I start my program in 3 days. So anyway, they were able to stabilize me, stabilize baby, and they said, okay, we're gonna send you home, but if you have more bleeds, we got to put you on bed rest. So now I'm going into this program, basically telling all my faculty, hey, I'm sorry, I'm pregnant, I might be on bed rest. It's my first day here. Very awkward, very uncomfortable. Anyway, so every week, actually, up until about 30 weeks, I would have a bleed that would send me to the hospital for about 3, 4 days of the week. So I would spend half my week in the hospital every single week. Finally, my doctor told me, okay, we're really nearing bed rest. Like, we would put you on bed rest now if it wasn't for you begging, us to not put you on bed rest. And so anyway, at 30 weeks, I woke up, my daughter woke up screaming baby sister and woke up and just had, was just covered in blood. And we were like, do we call 911? Do we drive to the hospital? It's very dangerous. I ended up having a placental abruption, and it can cause tremendous blood loss and can lead to shock very quickly. So it's actually a very serious thing, and I didn't really take it seriously as much as I should have. Anyway, so at that point, went to the hospital. They said bed rest. So I actually lived from the hospital for 7 weeks.
Oh my
They would
goodness.
walk. I literally was in a wheelchair. If I wanted to, go outside, my husband would have to take me in a wheelchair. And I took all my classes from the hospital bed. I would be up, all night with doctors and then have to attend lecture literally on 30 minutes of sleep. I'd bend all my projects from the hospital. My husband would drive them to school. I'd get feedback. My husband would drive them back. And, we just kind of made it work. My family would drive my daughter every day to the hospital. So, it was tough, but in a sense, it was all ortho because I was at the hospital and I joked with my faculty that I was getting the most out of my money because I had nothing else to do except for ortho. But it was difficult. So I ended up having the baby at 37 weeks. Everything was fine, no complications. We were good. And took a few weeks off with the baby and then went back to school and just kind of went full force. There was a lot I felt I had to make up because, my faculty, I think, had this feeling that, is she really into this? Does she want to learn? And so I felt like I had to put 200% of my effort in just to prove to them that, hey, I'm taking this seriously, because I don't know if they really thought I was taking it seriously when I first started because I was just in and out of class so much.
Yeah.
So, yeah.
Well, wow, that's an amazing story. Like, it's hard for women, and then thank you so much for sharing because, like, I'm at the age of thinking about do I want to have kids, but I know I have 2 more years of residency, and people don't really talk about this. And you think 10 steps ahead, like you were mentioning before. So I appreciate you sharing this, and I'm sure a lot of other women are thinking about this, but they don't know, like, what other people are going to think, like, what are professors going to think. You have shown that it's possible, but that it's not easy. I think you exemplify like a really good applicant for getting into ortho residency. And part of that comes with you thinking 10 steps ahead. But if you're going to give advice to someone in dental school or someone even in college, like thinking about dental school, and they're thinking about ortho, what advice would you give to them?
Yeah, so a few things. So number one, GPA is probably the most important. If you don't have a really high GPA, it's not end all be all, but just try and keep your GPA as high, as you can. I definitely didn't have like the highest GPA, so and I knew that, applying. So I did other things. Was involved in a ton of extracurriculars. I always found that making connections was one of the most important things.
Mm-hmm.
And when I was in dental school, I attended with you, actually, with you, we attended the AAO conference in Chicago. And so it's an annual conference. They hold it once a year. Every orthodontist practically goes to a city, and it was Chicago for us. And it's so embarrassing, but I printed pictures of like each of the chairmen of the programs that I wanted to apply to and went into this hall and tried to find as many as I could and just go up and introduce myself. Obviously, it's really intimidating. And I was just like, I'm going to put myself out there and see where it gets me. And imagine thousands of people. I'm like, how am I going to find these like four people I want to talk to? So I would suggest, doing that, like putting yourself out there, going to these events because I feel like the connections I made at AO actually helped me in my interviews because I had met a lot of the people who were in my interviews, residents, faculty. So conferences, reaching out to schools, putting yourself out there, GPA. I suggest research. I didn't do it, but they asked me about it, and I think that was a big thing. So I think research and just being as involved as you can.
Okay. When you printed out the photos, did you think of that yourself or did you get that idea from someone? That's a great idea.
I thought of it myself.
Okay.
I honestly haven't even told my faculty yet. I think
That
they weird. I
that's so
feel like
funny. When I was trying to practice for interviews, I actually printed photos of the people I was going to interview with and I put them like by my desk.
it's a great idea, though.
So it's just which is very similar to what you did. Like you're practicing for what like I knew what I was looking at. Like I was trying to prepare myself for that experience and you did the same thing.
That is honestly so smart. And actually, piggybacking off of that, one other piece of advice that I do have when you do get the interview for ortho, go and look. Number one, reach out to residents because they will tell you what the programs are looking for. So I
Hmm.
reached out to residents of every program I got accept or interviews to. What do they want to hear? And they would tell me they were very upfront about it. Every school is different. Every school wanted to hear something different. Number two, research the faculty. There's only like 10 faculty per school. There's not a lot. And look at their biographies because before I interviewed at one school, I won't mention which school, but I interviewed at one school and I looked at, this guy's biography and I remembered he was from Germany. And I remember bringing up in the interview that my husband's from Germany kind of on purpose. And him and
Hmm.
I, literally the whole interview, were just bonding over how my husband's from Germany and how he's from Germany. And so just being smart in that sense, I think goes a long way. So, in my opinion, that is a huge factor when you do get that interview.
Yeah,
Yeah.
that's great advice. Before applying to ortho, did you do any externships at other schools or did you shadow orthodontist?
I shadowed a few orthodontists. One was my mentor, and I didn't apply for formal externships. So I know there's a lot on the East Coast, Oregon, there's a few over here on the West Coast, but the California schools, most of them don't have like externships that you can apply for. So I actually reached out to schools in California to secure externships. So just because a school doesn't have a formal externship or shadowing day, reach out to them and odds are they'll let you come and take, shadow the school. So I
Oh,
did for
okay.
UCLA, USC, and Loma Linda.
Okay, you definitely put in the work. You definitely did your research, so that's it's good to know. All right, so now that we're wrapping up, what advice do you have for all the incoming residents and for me since I'm going to be an incoming resident and any other final words of advice that you have for the viewers?
Yeah. So, and again, congrats. I don't even know if I said that, but huge congrats. I'm super excited for you and to be colleagues with you. Um,
Thank
I
you.
I would say biggest piece of advice is that in residency, it's really a pass or fail. Like everyone passes residency. There's nowhere to go from residency, right? Except to go work. You could put in 5% of the effort and graduate as an orthodontist. You could put 100% of the effort and graduate as an orthodontist. My advice is give it your 100%. This is residency. It's called you're a resident because you live at that school. So just put in as much and just soak in everything you can because this is what you're going to be doing for the rest of your life. And every day I'm committed to writing down at least 5 things that I learn in clinic. And this past year, I think I have 40 pages of notes that have compiled together of just things that I learned in clinic because there's so much to learn and there's so little time. And when you graduate, you're going to be expected to know how to treatment plan and know how to to be an orthodontist. So just put in the work. It's residency for a reason.
That's great advice. All right, Deena, thank you so much for coming on.
You are so welcome. Thank you for having me. It's so good to see you again.
Good to see you too.